we can talk about the other side of the equation too. So what are the downfalls of breastfeeding for moms? For those of you who don't know me, I'm Dr. Lauren Davis. I'm a functional medicine physician who specializes in postpartum health. So we know that breastfeeding is a huge time commitment. So there was a study that went viral a few years ago. It's around 1,800 hours per year for a mom to breastfeed, which is the equivalent essentially of a full-time job. Now, does that mean formula feeding families don't have some of the same time commitments? Absolutely not. But for formula feeding families, feeding responsibilities can be split among other people, so it's a little bit less taxing on mom. Health-wise, we think about bone density when it comes to breastfeeding moms. So suckling of the breast releases a hormone called PTHRP, otherwise known as parathyroid-related hormone. And what PTHRP does is it stimulates the bone to release calcium. Breastfeeding moms lose between 3 and 7% of their bone density, which is completely reversed when this protein goes away. So unlike other forms of bone loss, this is not a long-term issue. The bone maintains the same structure, which is really important because osteoporosis and osteopenia cause loss of what's called trabecular bone. The bone inside the cortex, the thick part, is called trabecular bone, and that stays the exact same. We don't have to worry about that rearranging, which is the hallmark of osteoporosis. The other interesting thing that we need to talk about is that for breastfeeding moms with neurodivergence, we see a lot of other issues crop up related to low dopamine levels. Why? Because prolactin release requires dopamine levels to drop in the brain. So women who are neurodivergent experience a lot more mood disorders. They experience executive function that is worse while they are breastfeeding compared to the rest of the population. And there are ways to help cope with this, but if we're not aware of the problem, we don't know that it's worse for these women. So let me know in the comments below what else you want to talk about when it comes to postpartum health.